The obesity epidemic in America. A new report is revealing alarming findings, especially when it comes to kids. Dr. Nancy Snyderman is NBC's chief medical editor. Nancy, good morning to you. Very upsetting.
It's upsetting, Meredith, and this is a study that everybody has to pay attention to. Obviously, for American parents, this is important because as the waistlines of our children increases, we now expect that their life expectancies will fall.
It's one thing for an obese 45-year-old to develop type 2 diabetes at age 55 and then have a heart attack at age 65. It's a very different thing for the clock to start ticking at age 10.
In a shocking report in the New England Journal of Medicine, Danish researchers link high body mass index at ages 7 to 13 to the development of heart disease in adulthood.
This generation of children, due to the high prevalence of obesity, is in store for a massive increase in heart disease when they become adults.
In the U.S., each generation has enjoyed the expectation of living longer and healthier lives, thanks to the introduction of antibiotics and then immunizations. But for the first time since the Civil War, life expectancy is predicted to drop an average of 2 to 5 years. And the main reason? Obesity.
For life expectancy to be limited not by having too little to eat, but too much to eat, is unprecedented in the history of our species.
Take your weight.
Cindy Zedek runs a pediatric weight control program at Stanford's Lucille Packard Children's Hospital. She says the key to fighting the epidemic is early intervention.
It's really important that kids who know their BMI is high already try to make these changes now so they can reduce the risk in the long term.
So when 12-year-old Shadi came to the program with a family history of heart disease and a high body mass index, Cindy enlisted Shadi's whole family to help.
My mom came with me and helped, and we sort of wiped out everything that was bad.
Now Shadi's weight is down to where it should be, and she's learned to make healthy choices that she plans to stick with for the rest of her life.
I'm getting healthier, and I feel better. I can go out. I feel like I can do anything. I have a lot more energy.
What we're seeing now is a perfect storm of environmental factors that have led to 1 in 3 American children being either overweight or obese. And if that doesn't frighten you, consider this. By mid-century, obesity is projected to cause more deaths than all cancers combined. It's a fallout, Meredith, that is going to haunt our children and our grandchildren, and we cannot play on a world stage as a superpower or an economic power if we aren't healthy. This is a screaming, screaming red light.
And it's hard to know where to start to fight this, but there are new guidelines that came out in the journal Pediatrics that are aimed not just at stopping the disease or treating it, but really in preventing it.
Right, we have to prevent it, and you can't put everything on the patient. So these are guidelines for doctors and patients. For doctors, you have to get kids' BMIs, this body mass index. Right now, only 30% of doctors
see that to me is shocking. Yeah,
ridiculous. You have to do cholesterol screening again for 10-year-olds, and then have that hard talk. If you have a chubby kid in the office, you have to address it. We cannot stand to be politically correct anymore.
And what should parents be doing?
Very important things for kids. You have to get an hour of daily exercise. It doesn't mean gym class. It means running around. But schools are going to have to step up to the plate. Family meals, and boy, get your kids breakfast. If children eat breakfast, they eat better through the day. Sit-down family dinners at the dinner table, and then talk about this. Make it sure it's a family thing that you all own together.
All right, Nancy Snyderman, thank you so much.
You bet, Meredith.
Nice to have you here.
Thank you.